What happens after a TB court scan? Imagine you've just had a detailed scan of your lungs to check for tuberculosis. Now, what happens next? Well, the images from the scan are carefully examined by healthcare professionals. They look for signs that can tell if the disease is active or if it has healed. The scan provides a clear picture of your lungs and nearby structures, revealing features like lung cavities, small nodules, enlarged lymph nodes, or patterns that suggest active infection. For example, a tree in bud pattern indicates small airway spread, which is a sign of active tuberculosis. These details help doctors understand how severe the infection is and whether it's still active or not. Once the images are analyzed, the next step is to confirm the diagnosis and assess how active the disease might be. If the scan shows cavitation, which means holes in the lung tissue, or signs of bronchial spread, it usually indicates active tuberculosis. On the other hand, if the scan shows scarring or calcified lesions, it might mean the infection has healed or is inactive. This information helps doctors decide whether to start or adjust treatment. If active tuberculosis is confirmed, your healthcare team will likely begin or continue anti-tuberculosis therapy. They may also use follow-up scans during treatment to see how well you are responding. Improvement in the images, such as reduced cavities or nodules, often matches how you feel in your clinical progress. Sometimes, after a couple of months of treatment, a follow-up chest X-ray is done. If the X-ray shows significant improvement, further scans might not be necessary. But if the response is unclear, or if there are concerns about ongoing disease, a repeat court scan might be ordered to get a more detailed look. The court scan also helps identify complications. For example, it can detect fluid around the lungs, pus collections, or abnormal connections like bronchopleural fistulas. In cases of multi-drug-resistant tuberculosis with multiple cavities, the scan helps locate all affected areas and can assist in planning possible surgical options if needed. Finally, all the information from the scan is shared with your healthcare team, who will incorporate it into your overall care plan. They will discuss the findings with you and decide on the best course of action to ensure effective treatment and prevent further transmission. So, in essence, after a tuberculosis court scan, the images serve as a vital tool to confirm diagnosis, evaluate disease activity, guide treatment, monitor progress, and catch any complications early. Always remember to follow your doctor's advice and have regular checkups to stay on top of your health.